Hey, we're going to be talking about the concept of cellular regulation. So this is a new concept for you guys this semester, but it's pretty simple. You probably remember some of this from taking A&P, hopefully. Remember that the cell is the basic structure of every living organism, and they serve specialized functions depending on where they are. So cells cluster and they form tissues. Those tissues form organs. Those organs form organ systems and then organisms. So we want, if it's functioning the way it should, cells should regenerate at a certain time, they should die at a certain time, and they should maintain their borders and stay within their tissues. So the concept that, or the exemplar that we talk about today is cancer and how that cellular regulation becomes dysfunctional. So normal cells grow and divide, like I said, and form new cells only when needed, and the old and damaged cells die off. So cancer cells, they form new cells when they're not needed, and the abnormal, old, or damaged cells do not die off. They just keep forming clusters, and that's when they eventually form tumors. So a neoplasm is a word for that independent mass of tissue growth. It's the growth that just keeps regenerating when it's not supposed to, but also the cells that haven't died off when they should have. You can have a benign neoplasm, also known as a tumor, which means that it's not invading other tissues, it's not spreading. Or you can have a malignant tumor, which does invade. It goes past its borders. It invades other tissues. It can get into lymph tissue. It can get into blood. It can get pretty much anywhere. So when we think of terminal cancer, we think of malignant neoplasms. So benign can also be troublesome because it can press on organs. It can become uncomfortable or, unsightly. So we really talk about both of these. So as you can see, the benign is slow growing. It maintains its borders. When we get rid of it, it usually does not come back, and it doesn't spread. So the malignant, it can be rapid. It can recur even after it's removed. So that's why it's important for us to grab all of the cancerous cells, because they can regenerate if not. And eventually it will become terminal if we don't treat it. So carcinogenesis is the study of cancer and how it originates. So these are three different theories of how cancer can originate. And just remember, cancer is just an abnormal growth of cells. So that can be caused by carcinogens, which are things that can cause cancer. You probably know some of these already, things like pollution, smoking, some of the foods that we eat, if they have a lot of preservatives in them, those can be carcinogens, radiation, those are some examples. So oncogenes are genes that can stimulate cancer growth. Some of that can be genetic. And tumor suppressor genes are the opposite. They suppress cancer tumors, but if for some reason they mutate or they get deleted, then it can cause a cancerous growth to occur. So some of these risk factors you may know, genetics is a big one, right? So if you have a family history of cancer, then you're going to be at a higher risk probably, especially certain types of cancer like breast cancer is a big one that has a huge genetic factor. Age, as the older you get, the greater your risk of cancer increases. Some cancers are more common in certain genders, like breast cancer is more common in females. Obviously, prostate cancer is only in males. Your lifestyle choices. Smoking pretty much increases the risk of every type of cancer. We always think, lung cancer first, but every cancer, the risk is increased with smoking. Also drug use, alcohol use, stress, believe it or not, can really put a lot of stress on your body, not just mentally but physically, and that can trigger an abnormal growth of cells. Diet is huge, especially here in the US, where we like a lot of protein, we like our meats. But remember, protein is the building block of your cells, so if we have more than we need, it can trigger an abnormal growth of cells. There are some occupational risks, for example, radiation. If you're a rad tech, then you're exposed to a lot more radiation than the average person. Some infections can also trigger cancer, so think of like HPV for cervical cancer, or H. pylori for stomach cancer, HIV for Kaposi sarcoma. So there are about 1/3 of cancers come from infections. Obesity is a risk factor, and then sun exposure. Skin cancer is the #1 type of cancer in the US, so that usually comes from sun exposure. How we like to bake ourselves, especially around here by the beach. So it's really important when you're doing a physical assessment to look for some of these signs and symptoms in cancer, because cancer is so common here in this country. So we're looking for any disruption in function, and that could be every body system. So think of change in bowel or bladder, for example. So if somebody's been regular their entire life and then all of a sudden they're having trouble with constipation, that's something that needs to be investigated a little bit further. When we do blood studies, think of CBC. We're looking at the hemoglobin and hematocrit. We're looking at the platelet count, red blood cells, white blood cells. These are all things that by now at this level you should know the normal ranges of. If you don't, that is something you need to memorize as soon as possible, because now we're analyzing and we need to get beyond the normals so that we can see the abnormals. So if we see that a hemoglobin is very low and we don't have a reason why, we need to figure out why that is, right? Investigate a little bit further. Look for any unusual infections. Sometimes cancer can do certain things to you. It can create fistulas, like pathways between two organs. For example, the bowel and the bladder, for example. So if we're seeing lots and lots of UTIs and we have no explanation, we need to do a little bit further investigation. Hemorrhage is another thing. So lots of bruising, unexplained bruising. Pain is always your body's trying to tell you something when someone is experiencing pain, so we need to figure out the cause of the pain, not just treat the pain. So this is a little acronym that's kind of helpful in doing your assessment. Caution, so the change in the bowel and the bladder, any sore that does not heal, especially for skin cancer. If there's a mole that you've had forever and then it just keeps crusting over and bleeding, probably need to check that out. Any unusual bleeding or discharge, especially like for women. If you have a female that has gone through menopause and suddenly they start having vaginal bleeding again, that's kind of a warning sign, so we need to look at that. Any thickening or lump in the breast or really anywhere in the body, and these types of lumps, they're firm, they're usually non-movable, usually not painful, so when you move them around, they kind of stay stuck. They feel like they're anchored in. Indigestion or trouble swallowing. Any changes in warts or moles. So is it getting bigger? Is the color changing? Are the borders irregular? And we'll talk about that a little bit more when we talk about skin cancer. And then any nagging cough or dry or hoarseness that's unusual and new. We need to investigate further. These things by themselves obviously don't mean that you have cancer. They're just some warning signs of cancer, so we need to investigate further to find out the cause. Another thing that happens with cancer is anorexia and cachexia. So anorexia, that word just means loss of appetite. Okay, so with cancer, you have these cancerous cells that need a lot of nutrition, so they start to steal the nutrition from the healthy cells. Not just that, but for some reason, and I'm not really sure why, but cancer itself causes a loss of appetite. And then also think about, just the stress that you're under when you have cancer. Some people lose their appetite when they're stressed out. And then some of the treatments, like chemotherapy, can cause nausea and vomiting. So all of those things together cause a really severe weight loss and malnutrition, and you see this person becomes very emaciated, and you can just really see all their bone structure. That's called cachexia. So we have that combination of anorexia and cachexia. And that is one of the questions you should be asking during your assessment is, have you had any recent weight loss, unexplained weight loss? So I'm not trying to lose weight, but suddenly the person's dropped 15, 20 pounds. That needs to be checked out, right? That's something that could be a warning sign for us. So if we have some of these warning signs, we may need to do a little further investigation. So these are some of the tests that we may do. We may, if we find an unusual mass, we may do a biopsy. So we take a little section of that tissue and look at it under a microscope to see if they look like cancerous cells. Could also do smears and check secretions, so we can do bronchial washings, or vaginal washings, like in a pap smear. And we'll also do blood tests. And the major blood tests that we're looking at are the CBC. So we're looking at the white count, the red blood cell count, hemoglobin and hematocrit, and the platelet count. Those are the big ones. Okay, there's other things that we may look at, but those are the big ones for this class. And we may do an ultrasound, we may do an MRI, we may do different scopes like an endoscopy, colonoscopy, sigmoidoscopy. If you're not familiar with what these are, this is the point in nursing school where you need to stop, go look it up so you have an understanding what I'm talking about. And then we may do CAT scans. So we have different ways of grading cancer. So grade 1 would be the least malignant. So it looks a lot like its parent cell that it mutated from. It kind of is staying within its borders. That's hopefully where the person is so that we can easily treat this cancer. And then it progresses all the way to a grade 4, which is the most serious, where it doesn't look anything like the parent cell. It's kind of mutated into its own being inside of you, and it's taking over. And that's pretty malignant at that point, difficult to treat. We also stage cancer using this TNM staging. So this is just for breast cancer, but we use this for every type of cancer. So T stands for tumor size. So T1 would be fairly small, 0 to 2 centimeters, and it goes all the way up to T4, where it's broken through the walls and it's attaching to other organs now. N stands for the lymph node involvement. So like for example with breast cancer, if it's a 0, then there's no lymph node involvement, and that's great because then if they have a mastectomy, they may not need to remove those lymph nodes. When we get to N3, it's already gotten into the lymph nodes, and then it can easily spread to other parts of the body. M stands for metastasis, so M0 would be no metastasis, so it's kind of in the one spot, easier to treat, obviously. And then as we go up in the grades, it's spread throughout the body and definitely a lot more difficult to treat. So pharmacology for this, there's innumerable pharmacy meds and chemotherapy meds, and we're not going to get into all of that. I just want you to know about these 6 categories. And the major things that you need to know with them. And fortunately, a lot of chemotherapy drugs are very similar, so if you know one, you kind of know the side effects of all of them. So, and pharmacology just means cancer treatment drugs. For chemotherapy, the cancer treatment drugs. So we'll talk about alkylating agents. These are the most common medications that you'll see in that drug category. All these chemotherapy drugs are doing is breaking down the life cycle of that cell.